Hi, I'm Carmen Wigmore. I go by she, her, and sometimes he, him pronouns. I am gender fluid, and I've been receiving care at the CHC in Port Hope for about 2 years and 2 months now. I feel like I've developed a lot more connections within the community through this program. I've been happier than I've ever been. Um, and there's just a level of being able to look at myself in my mirror and in photos and not really hate what I see back. Loving yourself is kind of hard and it makes it a lot easier.
The Gender Affirming Care Team at the Community Health Centers of Northumberland serves the trans and gender diverse population within Northumberland County. Previous to this, individuals living within Northumberland County would have to travel extensive distances to other locations. So by creating a gender affirming care program closer to home, we're able to reduce wait times for individuals, as well as create more accessible locations, taking into consideration sort of the whole person approach.
I've been receiving care here at the Gender Affirming Care Clinic for just about maybe a year. There can be quite a bit of wait lists, and some of them are really long. The wait time here, I found it to be just a few months. It was very short. Yeah, I'm very happy that I found this.
So some of the services that we provide here within the Gender Affirming Care program would be our medical team, which is made up of a nurse practitioner, a physician, an RPN, and an RN.
So as clinicians, our main role is providing hormone therapy, kind of getting people started on therapy, figuring out what their goals are, helping them through the new medications and what to expect and all of that.
Then I do the intakes and then do all the scheduling and the booking. So then the injection teaching and dressing.
We talk a lot about support systems and what's happening at home, what's happening in your community, what's happening at work, and try to get these patients involved.
We have a peer support worker who's involved with clients right from that referral inputs.
I provide the intake services for people who are coming into the gender care program. I also do one-on-one counseling services. I facilitate the gender care support group. Peer support is so important to this role because transition is a very personal thing. It's a very personal journey. I'm part of the same world that they're in, and I can both commiserate, but more importantly, offer advice.
When I come here for care, I genuinely feel like these people aren't coming to work for the money, but to make a difference in people's lives. And that genuinely makes the difference in people's lives.
I think it's really incredible what we have managed to do with the resources we have.
We did this as a team, I'd say, pretty well from the beginning. Once we had the idea that there was a gap that we needed to address, we put the call out to the entirety of the CHC, and we had really good uptake.
One of the things that we did to ensure that care was culturally appropriate and informed by the clients is working with our local individuals that either are part of the trans or gender diverse community.
We've definitely benefited from our partnership with Centertown in terms of their mentorship on all levels.
And I think it's important too that the CHC has given everybody in the on staff, whether or not they're involved with the Gender Affirming Care Team, is the chance to do some training, through Rainbow Health Ontario.
I think gender affirming care here at our CHC is to present a feeling of safety And that's as soon as the patients walk in the door. Well, we have the one patient, Tammy, and I have seen a couple times who's 65 and just now transitioning.
I called her name for the first time. Like she heard her name for the first time, like in the waiting room. Yeah. And she was like, she didn't like, is that me? Like, you're calling me type of a thing. Yeah. So that was amazing too.
Seeing people thrive, it's wonderful to see them come in with the walls up, with their defenses up, and just over time as they come to see me over, having access to transition care, having maybe gotten on the list for surgery, having made some friends, and it's completely night and day. I am incredibly grateful to be given the chance to help be part of that process of helping people get there.